Hello, welcome everyone to this month's chat between the Domestic Violence Center and LCH. My name is Daphne and I'm a caseworker here at LCH, and with me is Maria from the Domestic Violence Center. Hello, Maria.
Hi Daphne, hi guys.
So in July, we celebrate the National Minority Mental Health Awareness Month. And the purpose is to bring awareness to the unique struggles that racial, ethnic, immigrant communities face regarding mental illness. We already know about the challenges that the general population has accessing the mental health system care. Example, due to the lack of providers overall. But diverse minority populations are more vulnerable, and they're more likely to experience risk factors that can cause mental health disorders. So in that context, we'll focus today on domestic violence and the mental health of minority survivors. Maria, when we talk about minority mental health, who does it apply to?
So that's a great question. So within our conversation, we're going to be talking about people from communities of color, as well as other groups like sexual minorities, gender minorities, but anyone that would feel like the minority of the population, but not minority in the sense of like human being. We want to make sure that we establish that boundary.
Yeah. Yeah. So what mental health issues does a survivor of domestic violence face? And how is that different from someone from a minority group? How is that different from what they would experience?
So domestic violence survivors of ethnic minority backgrounds are more likely, just as you stated earlier, to struggle through mental health problems, including low self-esteem, anxiety, depression, PTSD, and suicide, but not limited to these things. And so what does that look like? There's already a struggle when us as human beings are born into this world a few shades darker. And that's just the reality of the world that we live in. And unfortunately, that is the reality. However, that's not the end all be all. And so there's countless organizations that have been fighting for hundreds of years to make sure that we're combating against what has been the norm, so that the norm is that everybody can sit at an equal table, aiming for equality, diversity, inclusion, including months like our month, that it's not just Mental Health Awareness Month like it was just a few months back, but that it's Minority Mental Health Awareness Month. Us as minorities, we struggle through so much already in life. And I think that just adds to the fact that mental health is a huge struggle. Depression is something that's not talked about. It's just like, oh, you're just having a bad day, when in reality, it's a chemical imbalance that you might need medication for, and that's more than okay. You might need somebody to talk to, and that is more than okay. So just having those conversations, but also within our respective races and ethnicities, a lot of minority backgrounds, especially those that have come to the United States for a new life, for the American dream, for newer opportunities that maybe their home country didn't afford them. Within that, there is the belief that reaching out for help shows a sign of weakness. And that is an old school mindset. So thankfully, our generations are doing the hard job of making sure that we are fighting that and combating that and breaking those generational curses. But it takes time. And so it takes time to make sure that you're informing your parent, your grandparent, your great grandparent that it's okay to reach out for help. And that's hard. That's hard.
Yeah. And we know women from minority populations face greater economic challenges. They have less access to health insurance. They have difficulties getting transportation, finding childcare to go to their mental health appointments.
Yeah, I think that's huge that you touched on that as well, Daphne, because what if they don't speak the language? They don't have a support system here. What if they're the only one that came because of a family member of a friend? And so they don't necessarily have a huge support system within this country, within their respective city or town. And so they don't even know what the first step looks like. They don't know who to reach out to, what that looks like, especially within a domestic violence situation. Your abuser makes it look like they're your end all be all. And so you feel trapped and you don't feel like you have somebody to advocate for you or somebody that's really on your team.
Yeah, and language barrier also is a huge problem, right? Finding a provider that speaks their language that lack of diversity among mental health providers.
Yes.
That they can maybe, not meaning to, but there could be cultural misunderstandings, cultural insensitivities because of that, because of the lack of diversity among providers.
Yes, I completely agree. And I think that's one of the reasons why, especially within the last 10 years, but specifically within the last 5, especially with George Floyd and everything that has come out through the last few years with the pandemic and everything that was exacerbated during the pandemic, especially mental health, especially domestic violence. We saw a huge growth in those type of unfortunate cases and tragedies. But within that, there's a lot of healing. So social service agencies especially have piloted so much within our communities to get people that speak languages to meet people where they're at. And LCH and DVCCC are a part of that. And I'm grateful to be a part of that too.
Do you see, how do you see the composition of these minority groups here in Chester County?
So you see a lot of South American population. You do see, we are seeing a growth in our Asian population and even our African American and Native American indigenous population. We're just seeing a huge growth across the board of a variety of ethnic backgrounds.
And so you did mention them briefly, but what are some of the available resources and support systems available specifically for these groups?
So we do have groups that are able to translate if they don't have somebody readily available that speak their language or their respective native language. We do have services readily available to translate for them to make sure that they are getting not just the services provided to them, but that we're able to reach them where they're at, whatever that may look like. We have groups that are tailored to women, to young women that may not be documented so that they feel supported, so that they feel heard. We have groups tailored toward refugees, Ukrainian refugees, especially with what's been happening the last few months. So just making sure that we, not just that we have resources, but that we make that readily available to our community.
So have you seen a generational change in how our communities view accessing the mental health system? That is, do you see the younger generation assume a different attitude towards getting mental health care?
Yes, huge change. It's like night and day. Growing up, I know for me specifically, I'm Puerto Rican Latina. My parents came from Puerto Rico back in the 80s with 4 boxes and like $250 to their name. And so seeing the difference in the growth and the way that my parents speak about how like Philadelphia was when they first moved here in comparison to now is a vast change. So I can speak specifically personally to my dad, just seeing the changes in him. And like my dad is 73 and like now he's willing to talk about emotions and now he's willing to talk about mental health and things that he's always shown. My dad has struggled with depression for years, but being open now about it, being open about the fact that he takes medication for that, and being comfortable enough to tell other men that like it's okay. He's learning that it's okay and that it's okay to tell other men that it's okay specifically. And especially because in the Latino Hispanic culture, we have machismo and we're combating that. But Gen Z is not a generation to play with. They do not play when it comes to people's rights and mental health services, availability, making sure that if you need a therapist to go find one, that it's available to you. We have seen a huge need for mental health specifically tailored towards depression, suicide, anxiety. The pandemic was not just like a local change that happened here or a nationwide change. It was a worldwide traumatic event that us as a world, right, like experienced all at once. And so learning that that's why isolation is dangerous and can be dangerous. And that's why it's so important to have the resources readily available, but also like that you act on that you call the number, that you reach out for help, that you say, hey, I need help. I need someone to hear me. But I definitely think that Gen Z is far more readily available to ask for help and provide those resources for others.
And I just wanted to just mention briefly that Pennsylvania now has a new way to connect to mental health crisis services, and that's 988. It's a suicide and crisis lifeline. And of course, they can reach out to DVCC, they can reach out to LCH. We have spectacular behavioral health counselors here at LCH as well.
I love that. I love that our state is acknowledging that. And it's not just our state, but states all across the United States. are acknowledging it and making the changes, and our legislators are making the changes necessary to make those resources available.
Well, Maria, thank you so much. And I want to thank everybody for joining us today. And if you have any questions, you can put them, type them in the chat, and we'll get them, we'll get to them.
Thank you.
Have a great day, everyone.